Alzheimer's disease and related dementias present significant challenges across all demographics, but disparities in prevalence and care are particularly stark within the Black community. These disparities are rooted in a complex interplay of socioeconomic factors, healthcare access, and underlying health conditions. Let's explore the heightened risk of Alzheimer's disease and related dementias among Black adults, the compounding factors of comorbidities like hypertension and diabetes, and the unique challenges faced by Black caregivers. A 2021 study published in the journal Alzheimer's and Dementia indicates that Black adults are 64% more likely to progress to Alzheimer's disease and related dementias than non-Hispanic whites. Another study from the National Institute on Aging found that 26.8% of Black participants were diagnosed with Alzheimer's disease and related dementias, or ADRD, compared to 36.1% of white participants. Although the prevalence appears lower in this study, the greater likelihood of disease progression among Black adults highlights a significant public health concern. Black adults are disproportionately affected by conditions such as hypertension and diabetes, both of which are potential risk factors for Alzheimer's. The National Institute on Aging study reported higher rates of these comorbidities among Black participants. Hypertension and diabetes contribute to the development of cardiovascular diseases, which can impede blood flow to the brain, thereby increasing the risk of dementia. This correlation underscores the need for comprehensive healthcare strategies that address these risk factors early in life. Socioeconomic disparities play a critical role in the higher prevalence of ADRD within the Black community. Limited access to quality healthcare services often results in delayed diagnoses and inadequate management of Alzheimer's and related dementias. Additionally, economic instability may make it challenging for some African American families to afford specialized care and support services. Education and awareness also significantly impact the management and progression of Alzheimer's disease. A lack of early intervention and appropriate care can exacerbate the disease's impact. Furthermore, systemic racism and historical mistrust of the medical system contribute to hesitancy in seeking medical help, leading to later-stage diagnoses and fewer treatment options. Caregiving in the Black community. The burden of caregiving falls heavily on the shoulders of Black families, who often face unique challenges compared to other racial and ethnic groups. Black caregivers frequently experience higher levels of stress and emotional strain due to the demanding nature of caregiving, compounded by socioeconomic factors. Economic strain. Some Black caregivers are employed in low-wage jobs, limiting their financial ability to pay for professional caregiving services. This economic strain often forces caregivers to juggle multiple responsibilities, increasing their stress levels and impacting their own health. Health disparities. Caregivers within the African American community often have their own health issues, such as hypertension and diabetes, which are statistically higher than their respective counterparts. The physical and emotional toll of caregiving can implode these conditions, leading to a cycle of deteriorating health for both the caregiver and the care recipient. Lack of support systems. There is a notable lack of culturally competent support services tailored to the needs of Black caregivers. This gap leaves many caregivers without the necessary resources and support networks to manage their responsibilities effectively. Comparative statistics and prevalence studies. Various prevalence studies in cities like New Haven, Connecticut, and Houston, Texas, have found higher rates of dementia among African Americans compared to non-Hispanic whites. These studies highlight the geographic and community-specific nature of ADRD prevalence, emphasizing the need for localized interventions and resources. Addressing the disparities. To mitigate these disparities, targeted interventions are essential. Increasing awareness and education. Culturally tailored education programs can raise awareness about Alzheimer's and dementia within the Black community, promoting early intervention and proper care management. Improving access to healthcare. Expanding access to quality healthcare services and ensuring early diagnosis can significantly improve outcomes for Black individuals with Alzheimer's and dementia. Supporting caregivers. Providing financial assistance, respite care, and culturally competent support services can alleviate the burden on Black caregivers, enabling them to provide better care without compromising their own health. Research and advocacy. more research is needed to understand the specific needs and challenges of the Black community in relation to Alzheimer's and dementia. Advocacy for policies that address health disparities and promote equity in healthcare is crucial. In conclusion, the disparities in Alzheimer's disease and dementia care within the African American community highlight the urgent need for comprehensive and culturally sensitive interventions. By addressing the underlying socioeconomic factors, improving healthcare access, and supporting caregivers, we can work towards reducing these disparities and ensuring better health outcomes for all individuals affected by Alzheimer's and related dementias, as well as their caregivers and families. I hope you enjoyed this video. Your support helps me continue to raise awareness and provide valuable information on crucial issues affecting our communities. Please like, share, and subscribe to my channel for more informative content on important health topics. Thanks for stopping by and visiting Cam's Purple Corner.